treatment of aortic disease, the El Salvador, Italy project, and the integration of the treatment technology in surgical planning. Thank you.
Thanks, good afternoon, everybody. I'm Paolo Magagna. I'm a cardiac surgeon. Between aortic diseases, no borders. Every patient, everywhere, deserves access to advanced care. But treating these complex cases requires more than skills. It needs collaboration, training, and technology. For example, performing an extreme debranching is highly demanding procedures, testing surgical expertise. Advanced technology plays a key role in the treatment of complex aortic diseases. Hybrid prostheses such as Toraflex or Evita Open Plus, together with endovascular graft, allow treatment of the most complex aortic condition. Another key technology is the 3D printing. We use it for preoperative surgical planning, use it for education and communication with the patients and their families, use in anatomical education for medical students, and to create simulators for surgical training. In many of our hospitals, these procedures are now routine, but in some areas of Latin America, they are still not accessible. In this context, international collaboration and technology transfer are fundamental. So, in January 2019, a project of collaboration between Italy and El Salvador was born, combining clinical expertise and 3D printing for the treatment of aortic diseases. Through this project, we perform complex cardiac surgeries, train local teams, and share clinical cases online. We also support hospitals with advanced technology. Since 2019, we've completed 15 surgical missions, 41 complex cardiovascular procedures, including acute and chronic aortic dissection. We have performed 25 procedures, 6 of them through a minimally invasive hysterectomy approach, 4 complex aortic arch debranching, and 1 TIVA. Our results are very encouraging. Intraoperative mortality was 0, with only 1 reoperation for bleeding. During follow-up, we recorded 4 late post-operative deaths. In El Salvador, we performed for the first time cardiac surgery procedures, such as the implantation of a stentless biological prosthesis, right axillary artery cannulation, and the aortic arch replacement with a multi-branch prosthesis, together with a local team. We also shared a project already active in Italy for the creation of 3D models. We are sharing our knowledge and technologies, developing together the MAGA simulator, a portable training for kit for vascular anastomosis. We also wrote together a book in Spanish and English dedicated to aortic pathology and advanced technologies. A project made possible thanks to institutional and diplomatic support of the Ministry of Health of El Salvador, Dr. Francisco Labi, the Ambassador of El Salvador to Italy, Dr. Efrem Arnoldo Bernal Chavez, the Ambassador of Italy to El Salvador, Dr. Paolo Emanuele Razzo Sordini, and the Italian Ministry of Health for their continuous institutional and healthcare collaboration. We'd also like to thank some Italian associations, Aris Onlus and Amici del Mondo Onlus. And the true strength of this project has been finding people with outstanding skills, strong human values, and an exceptional team spirit. Special friend. Our dream is to extend the model we started in El Salvador to all Latin America, improving current collaboration with Guatemala and Honduras, Honduras and opening the doors to Venezuela, Costa Rica, and Nicaragua. Muchas gracias a todos por esta gran experiencia. Muchas gracias.
Thank you, Dr. Magan. Actually, my question was about how about to expand this to extend to other Latin American countries, and I think you showed us the last slides over there. Did you have any political issues? You see, because different governments, different ideologies.
Yes, very important question, and so it's very difficult situation, and so a different situation, political situation, because in El Salvador today the situation is very good, thanks to President Bukele, help, and together the Ministry of Francisco Lavin help this project. And so it's very, very important help to Ambassador El Salvador to Italy and Ambassador Hillary in El Salvador. It's very, very important to aid the support, this support. But I begin the very short experience with Guatemala, and so in UNICAR, and I started with 2 cases. But in other country like the Honduras, it's very difficult because the political situation is very hard. And so, but I wait. And our dream is to expand this project in all Latin American countries.
We from Brazil were still.
Congratulations for excellent exposition. We have in Natal, Brazil, a startup that is in our hostel. We do a 3D model since 2018, like you did there. We do only not aortic cases, but aneurysms, visceral aneurysms, legs and cardiac problems. And the question is the same of Tulio. Who's paid for that? Because we have so difficult. Sometimes I want to do my cases, I have to buy it. I'm the owner, but I have to pay everything. And sometimes another colleagues want to have these cases, and they don't have nobody to pay that. How do you help with that?
The technologies is a very, very important to have. A very important technology I have in Italy the special project for the 3D printing. So it's very, very important, and so it's very important to share. But it's very important to share the complex aortic cases with online. And so my colleagues to send the angiography, the tomography, and so we transfer. And so I asked the children of playing. And so, in some cases, complex aortic cases, organization to help physician, my colleagues in your country.
Well, but we know to do the 3D with the mold in your hands is different when you discuss with another doctor. So that's the point.
Yeah, but I started this project in Italy the 2020, and so in Italy the regulation is very difficult because I can use the 3D model not for the playing, because the medical device, we consider the medical device, but I think it's very, very important to use the 3D models for communication, education, and for the creation of the simulators. because for me it's very, very important, a very, very important education and communication with the patient and the families for the description of the risk, the surgery risk, and so it's very, very important.
Well, thank you for the presentation. We have an interesting project also with the 3D printing of aneurysm, and we use that for simulation. Over the 3D solid model, we created a silicone flexible model, and we put that in a pulsatile machine, and we trained the residents to do deployment of the endovascular devices, and it's beautiful, and it's transparent to the residents, and we published a paper on this education of the European Journal. Eventually, you can check it out. So it's really an interesting track of research that we're following. Congratulations.
Thank you so much. We create in Italy a simulator for the creation of the fistula, arterial fistula for the dialysis, and so it's very, very important to for the young surgeons to protection the anastomosis.
Thank you very much.
Thank you so much.
I think you are on time.
Yes, just